Welcome to Onya Digital Media, where we bring you the untold truth, the bold realities from Ghana and across the African continent. Today's story is heavy and it's one we all need to pay attention to. This is one of the darkest moments in Ghana's recent health history. Right now in Ghana, something terrifying is happening behind the scenes in our hospitals and morgues. According to mortuary workers, deaths have significantly increased since the nurses' nationwide strike began. Yes, you heard right. The people who are meant to keep us alive, the nurses, are absent, and the result, more people are dying silently, helplessly. So, latest development has it that the General Secretary of the Mortuary Workers Association of Ghana, Richard Kofi Jordan, revealed that mortuaries across the country are now receiving an increased number of bodies due to ongoing strike by the Ghana Registered Nurses and Midwives Association. Speaking in an interview on local media at Sampa FM, Kofi Richard Jordan said that if the strike continues, they may be forced to direct families to send bodies to police stations, as mortuary facilities may soon reach full capacity. Mr. Kofi is quoted to have said, "There is a surge in the number of deaths recorded in the wake of the ongoing strike, especially after the nurses embarked on a total withdrawal of their services on Monday. People are dying more across the country. Wherever there are mortuaries, we are recording high numbers of deaths. Many of these cases are coming from homes instead of hospitals. Those who are turned away from the hospitals complain that as soon as they got home, their relatives die. These are the stories we are hearing. So in our minds, we believe these deaths are a result of the strike action," he said. Undoubtedly, Mr. Richard Kofi Jordan added that the situation has put significant pressure on mortuary facilities nationwide. Mr. Kofi is quoted to have said, "We are enduring immense pressure following the strike. If care is not taken and the strike continues for a few more days, we will have to announce to the public that mortuaries are full. Hence, if a relative dies, the body should rather be sent to the police station. What is the mandate of the police? They are to maintain peace, law, and order. And so if we can't handle something and it might get out of hand, it is better to hand it over to the police for temporary safekeeping." The effect of this strike are serious issues. In my personal view, efforts should have been made to prevent this strike action. So the question is, what sparked this strike? The Ghana Registered Nurses and Midwives Association embarked on a nationwide strike on June 4, 2025, due to the government's failure to implement key provisions of their 2024 collective agreement, which includes allowances, incentives, and improved working conditions. These are frontline health workers who stood firm during COVID-19, many without insurance or proper protection, and now they say enough is enough. But while they stand for their right, lives are being lost. Responding to the issue, Minister for Government Communications, Mr. Felix Kwachi Ofosu, said projections indicated it will cost about 2 billion Ghana cedis annually to meet the demands, a figure that had not been included in the 2025 budget. Unplanned spending is what led to the past economic challenges, Mr. Ofosu said. "We must find a solution that protects the economy while addressing the concerns of the nurses." To address the shortfall in personnel, the Ministry of Health has appealed to retired nurses and midwives to offer temporary support. Also, the health minister has published a list of healthcare facilities to help guide patients to where services are still available, Mr. Ofosu said. The question many are asking is, did the Ghana Registered Nurses and Midwives Association pre-inform the government about their issues before the 2025 budget was read? Something I can't really put my fingers on. Now, who is paying the price? The poor, the elderly, pregnant women, children in critical condition. Without nurses to provide basic care, administer medication, or monitor patients, many are being left unattended in already under-resourced public hospitals. So far, government officials have called for calm and are urging nurses to return to work while negotiations continue. But the unions say they are tired of promises. They want actions, not press statements. Meanwhile, Ghanaians are stuck in the middle of the deadly standoff between those tasked to govern and those trusted to heal. This situation is rapidly rising. If the strike continues, we may begin to see avoidable death become the norm. If no compromise is reached, the healthcare system could collapse beyond repair. This isn't just a headline, this is a human story. A story about real people, real families, and real suffering. So here is the big question. Who take the responsibility? The time for long talks and delayed interventions is over. Ghana's health system is on life support and our leaders must act now. To our leaders, your people are dying. To our nurses, we understand your pain. But is there a middle ground? To the Ghanaian public, your voice matters. Pressure, speak up and demand answers. Silence is not an option. We will continue to follow this story as it unfolds. Make sure to subscribe, like and share this video. The truth must be heard. Hit the notification bell so you don't miss any update as we dig deeper into this national emergency. This is Only Digital Media. This is not just news. This is the voice of Africa. Well, the dew of the day has crept upon our thoughts and nature miles away its necessity. Here is where we draw the curtains. My name is Paul Mensa Makisu Yao Talibabu, aka Paul Lingua, aka the Africa Orator.